Well, hormone health can be difficult to navigate, especially during menopause. That's why RevitalyzeMD is helping break misconceptions and giving a tailored approach to treatment. Welcome, Dr. Debra Durst, to the show. Thank you so much for joining us today and just talking about a topic that I feel like is really not covered that much, perimenopause and menopause.
Yeah, well, thank you so much for having me. I agree with you. It's on social media. There's a lot on social media.
Absolutely.
But sometimes I think they have trouble actually finding a place to get an evaluation that's, so I think, is it true that it matches, like what you hear on social media, does it match what you're hearing in your regular doctor's office? And it doesn't always match. And that's something we hear on a regular basis is, you know, they'll ask questions and no one really tests their hormones and is it perimenopause? And so if we wanted to go into perimenopause and menopause right now, perimenopause is a transition phase.
Okay.
And so it is basically a phase you'll go through as you start to enter your menstruating years. Our hormones are all over the place.
Oh my gosh, yeah.
And then all of a sudden when we are exiting our menstruating years and, you know, procreating and having babies and all of that, then they go all over the place as well. And so in perimenopause, there's all kinds of things happening. We all almost call it a no man's land.
Wow.
You know, you can be moody, your sleep changes, you have weight gain, your sex drive is low, all kinds of different symptoms. And then menopause is that transition out. And so once you hit menopause, your ovaries are no longer making estrogen, and that's where you stay for the rest of your life. And so, but it stops making the other hormones too. And so all of those together we need to test and optimize in women, whether they're in perimenopause and menopause, and give them a clear diagnosis. Like, are you in menopause? Because if you're not, you don't need estrogen yet. So yeah, there's a lot of questions around it, and the primary care doctors are just not there yet. Not there yet with hormones. So
Yeah, and you guys really tailor an approach to every patient that you see, every client that comes in with what they're experiencing and how you can treat that. Because from what I've heard from friends and my mom, it's like, oh my gosh, what is happening to my body? And you're looking for those answers and those outlets. So talk to me a little bit more about that, not a one-size-fits-all approach.
Yeah, so I think in traditional medicine we're taught to, in traditional medicine means somebody's been trained, we've been trained to diagnose and to treat, and then we place patients on medications and never with the goal to take them off, right?
Right.
And so with preventative treatments, we start to screen for prevention, but really what we're doing when now people are looking for healthy aging. And so they're looking for prevention on a bigger scale. And so that's hormones. Hormones basically are not only helping treat symptoms, but they're also helping prevent bone, brain, and heart disease. And so what we do when we see a lady or a man, everyone should be customized, but traditional medicine, again, is insurance dictation. Like, so they dictate everything that you do, how often you can see a patient, how long you can see a patient, what kind of tests you do. And so again, if we have insurance dictating that care, then we can't see patients like we need to when they have questions. And so basically, we see a patient and we customize. Every patient is different. And the tests that we do sometimes are even different. And so we have to approach it that way, but you really need the time to do that. And in traditional medicine, their hands are tied. It's not like they don't want to see patients longer, but they really have a limitation onto how often they can see them and what kind of tests they can do. Absolutely. And so that's where hormone specialist or our office is different. We can take the time, we can get to know our patients very well, and then we customize everything because you're unique.
Right. Absolutely.
And so what you need is going to be different than what your friend needs or what your mom needs.
Absolutely.
And so, yeah,
Absolutely.
you got to approach it differently.
Right.
And I don't know if you know, but like the women in hormones, for instance, the WHI in 2002 pretty much shut down women in hormones.
Oh, wow.
And so it scared doctors and physicians, or doctors and patients.
Right.
And so basically, we're just now starting to get the information out there so we can treat again.
Absolutely. Well, where can people get in touch with you guys and find out about all of the options that you guys offer and get the help they need now and the answers, because this is so incredibly important. What's that website for y'all?
Yeah, and I say if always, like, your primary care doctor is doing that primary care and prevention and they're great with it, but if they're not answering the questions you have or you don't feel like yourself and you're not getting answers, then reaching out to an office such as ours and RevitalyzeMD, we do see patients both here, we see patients remotely, and you can reach out to our office. We have an active YouTube channel if you search my name. So there's lots of information that would make you feel comfortable even before you came into the office. So
well, thank you guys so much for joining us today. This is such amazing information here. Definitely go visit them over on the website and at their store.
Thank you.